Hello, I'm Namita Wadhwa, a WomenLift Health India 2022 Fellow. With computer science engineering and public policy education, I've spent 20 years designing and implementing solutions in technology, healthcare delivery, and governance. I work with IP Global, a development sector consulting firm, as a vice president in the social and economic empowerment practice. Leading a maternal and child nutrition program in a northern Indian state has deeply shaped my understanding of the challenges of delivering women centered programs in India. My project for WomenLift is centered on how to engage rural women leaders effectively in social change. With a high burden of wasting and low birth weight, children in India need special and urgent attention. It is well documented that both are significant contributors to infant and child mortality. Poor maternal and child diets and high anemia levels makes it a complex problem. My current project combines cash transfers and behavior change communication to address this. Together, they help women to choose better by providing additional resources and build their agency to eat better diverse diets. But the harsh socio-economic condition makes it a much more daunting task. With rigid and complex social norms, further complicates nudging behaviors for improved outcomes. While pregnancy is considered as a normal episode, childcare is the responsibility of women alone. The program thus takes a nuanced approach to behavior change, looping in various stakeholders like husbands who have the power of decision at a household level, other members of the household who can participate in childcare, and communities for an all-rounded enabling environment. The more we engaged, we understood the unrealized potential of women to impact this change, especially those who hold leadership roles in these villages. The objective of this project, therefore, became how do we engage with more women effectively, what empowers women leaders, and can the empowerment be structured for a larger impact? We work closely with village committees to mobilize the community for maternal and child health. Now, despite 60% of these committees being headed by elected women representatives, nearly 90% needed to be operational or actively engaging with their areas. A structured participation led approach was thus introduced to build the capacities of these committees. In 1 year, we saw a marked improvement, not just in the functioning and participation of these committee meetings, but also participation in these meetings resulted in improved infant and young child feeding practices. Nearly 50% of the committees that we worked with have women leaders more actively engaging. But more remarkable are the individual stories of change, be it mother in laws championing the cause of maternal or young child diets, or frontline workers making family planning their mission. We even have more men becoming partners in change for maternal and child health. The individual stories have now become practical tools to amplify the voice of the communities further. What started as a journey to discover and empower has transformed into one of recognition and motivation. An analysis of the leaders' profile further showed that the more engaged and active they were in these communities, the better were the results. As next steps, we are studying the motivators and barriers for these women leaders to be influential and identify incentives for them to be more active. Our engagement with district and state government to support these committees present a solid opportunity to integrate and pilot a structured intervention to empower these leaders. My personal journey with WomenLift has been one of self-awareness to self-realization. Having dealt with gender biases personally and professionally, I was pretty sure of the kind of women leader I wished to be, accommodative yet assertive. However, the self-reflections I made in the last 1 year helped me understand that the battle was only half fought. While the accommodation was plenty, I identified the need to be more assertive as a leader. I always believed in a strong voice. WomenLift re-emphasized the power that comes as a leader, the need to amplify the voices, and the role communities play. I could see the same path for my leadership project. I started to curate a structured intervention that will magically empower the women and draw their inner strength to bring change. But I soon realized that every story is essential. The difference would follow if we could pull them out and give them the desired recognition. I'm on the path of motivation and recognition to empower. Thank you for your time.